Good evening, good evening. Who is the first person to join us on today's ATP Live? I'm waiting to see you wave. Good evening. Hi, Dr. Boyede. Hi, Chizoba. Good evening. Good evening. Who else is joining us today? If you are online, just wave or say hi, hello, and I can see you. Hi, Obe Mipo. Good evening. All right, so wherever you are in the world, a very good evening. Hi, Chidima Olumba. Thanks for joining us. A very good evening to you all. I hope you're having a great day. I also hope you're having an awesome start to the new week. It's another episode of ATP Live, and we are on Facebook and YouTube. We are live on Facebook and YouTube right now. As you know, ATP Live is a program where we invite our doctors, to come, and then you get to ask any child health related issues that you have. Child health related issues, anything that you have about your child, any issues you're going through, just bring it up for us. We're not discussing any specific health issue. And today we have Dr. Ayo Renner on the hot seat. Yeah. Dr. Renner is a consultant pediatrician. He's a child health advocate and also a health educator. He's also known as the noisy Niger pediatrician because he will shout and he will talk and he will sing and call out any mom or dad that this constituency members, and you know who his constituency members are. So I'm going to add Dr. Renner to the stream now.
Hello, Angela. As in, I'm very happy with that introduction. Yes, indeed, I will call out anybody that is not my constituency member. They're in trouble with me and Buhari together.
I know. All right, so you're welcome, Doctor. Thanks for joining us today.
Thank you for having me, Angela. Thank you, as the pediatrician. Thank you.
Yeah. So please, if you are online, send in your questions. Whatever it is, we're just here waiting for you. The doctor has a busy schedule and he has told me he wants to end at exactly 7 p.m. So whatever you have, please drop your notes now. We're waiting. We are waiting for you to give you the sort of advice that you need. Dr. Renner, there's no question yet. Can you?
Yes.
I saw your post today about the woman who was force feeding the. Please.
Yes.
I mean, that's the height.
That was very hard to watch, but I just still try to just bring the humorous side out of it, because I know how frustrating it can be for mothers when babies refuse to eat. So sometimes you find out that, okay, you've done your exclusive breastfeeding or the baby has been collecting for, milk, And then you will get to that point where you want to introduce semi-solids. Some mothers have it very easy, such that their children accept the semi-solids very easily, whether it is pap, whether it is the commercially produced cereals, whether it is the food that you have mashed by yourself in the house, maybe mashed potatoes or rice that you have boiled and then blended, or maybe avocado puree. Some babies are very, very willing to have those. But there are some babies that by that 6 months, they are unwilling to even try anything. And so you find out that they keep on pushing the food out of their mouth, and their experts are doing that thing. All they just need to do is just their tongue, and nothing goes in. And it can be a source of frustration for a lot of mothers. So even though they are able to identify that, okay, this is something that is going on, some mothers, and usually it's not the mothers anyway, I mean, maybe not the ATP mothers, all the ATP mothers are wonderful mothers, but the grandmas, their next solution is to force feed the babies. Now, force feeding is a process in which the child is essentially, forced to take the food. And in that kind of situation, I've seen situations where they will turn the baby's head upside down, they will block the nose such that when the baby cannot breathe, as the baby opens up the mouth to breathe, they just rush the pap into the mouth. And I've seen situations where children actually died in the emergency room because the pap had gone not into the throat and into where the stomach is, but into the lungs. And so the lungs were now filled with pap and milk. And of course, that young infant cannot survive that kind of situation. So I would say that force feeding is never a solution to a child who is refusing the semi-solids. Instead, one has to be very patient. What has been discovered is that it requires up to 8 attempts to introduce a particular kind of food to a child before they accept it. And even when they accept that kind of food, you as an adult, are you eating rice every day? Are you eating moi moi every day? So why do you think your baby should be the one that you will use pap to suffer every day? No, it will get to a stage when they will get bored of what it is that you are giving them. Sometimes, even if they are not bored of what you are giving them, at that point in time, they don't want to eat, or that is not what they want to eat at that point in time. And so you really need to be creative as a parent. It really sparked up a very interesting conversation on my page when a mother said that a lot of the mothers that are shouting, hey, who, ha, here on this page, we find out that they too, because they are constrained for time, they have other children they are taking care of, they are cooking for their husbands, they are trying to juggle work issues. They don't have time to sit down and be trying to beg one constituency member to eat because they are extremely busy. And so the next result is that, my friend, will you take this thing? And so what then happens is that, so they decided that, so the mother was, what she was complaining of was that, and at the end of the day, a lot of mothers in Nigeria can't afford a lot of these things like all the commercial cereals that are available and packaged in the shelf. But somebody now said that, look, it doesn't have to be the packaged cereal. And you can actually do things as simple as beans, rice, cooked soft, sweet potato, yam that has been cooked till it is very soft, add things like crayfish, add things like milk, so there are various ways by which the locally available, foods can be pureed and be made in a consistency that a child at that age can readily take. So force feeding is never an option. It really allowed me to see, that particular video. So I had to share it with my community.
All right. Thank you very much, Doctor. We will keep re-emphasizing that until people begin to listen and do the right thing. We have at least 40 people viewing now. Chizoba Obeyemi Chidima, thank you so much for joining us. We have the first question from Sarah Aderonke, and she's saying, my baby has been having serious catarrh and cough and has not been feeding well.
Catarrh and cough. Right now, catarrh and cough seems to be the reigning condition in babies now. As a matter of fact, if you don't have catarrh and cough right now as a baby, you are not on trend, you are not on point, you are not trending. So I think it's the season. So as the rainy season sets in and the air becomes colder, I think that a lot of children start to develop this cough and catarrh. My worry with cough and catarrh is, next question is, first of all, how old is baby? And second question is there fever? Is there temperature? Now, what we always say is that cough and catarrh, they are in themselves very harmful. However, because of the presence of things like high fever and poor feeding, such children can get dehydrated very easily, especially if they are less than 6 months of age. Now, children who are less than 6 months of age, they get dehydrated very easily. So what we say is that if your baby is not eating up to 50% of her usual intake, so for instance, maybe the baby was, feeding 8 times a day, and now baby is feeding less than 4 times a day, or if you were measuring and baby was taking maybe 100 mils of milk with each feed, and now baby is taking less than 50, please, that is one of the reasons why we might need to admit baby into the ward, because the baby can get dehydrated very easily. Cough and catarrh usually is a viral infection that baby might have gotten from either the senior brothers or the senior sisters or another adult in the house, or from the creche where baby is going to. And that means that somebody might have coughed or sneezed on baby, and that's why baby is having that cough and that catarrh. Please don't give antibiotics. That's not the solution. Please don't, use your mouth to suck the catarrh from the nose, and don't rub mentholatum either. What you can do is that you can do steam inhalation, whereby you sit over a bowl or a bucket of hot water and then allow some of the steam to get into the baby's nostrils. That can relieve the nasal congestion. Or you can actually get saline nasal drops, drop into the nostrils of the child, and then use a bulb suction, one bulb suction like this, to suck the catarrh out of the nostril. But again, if baby is less than 6 months and is not eating up to 50% of her usual intake and has not had a wet diaper, you have not changed the diaper for wee. Baby has not wee in over 4 hours. Not wee in over 4 hours is also an indication of dehydration, and baby needs to get to the hospital. And please also don't do cough syrup, don't do Piriton. Don't do cough syrup, don't do Piriton. They are not recommended for children that are less than 2 years old.
Okay. Sarah, I hope you have your answer there. Please, if you're watching and you have a question, drop it in the comment section and the doctor will answer. We have this one from Ranti Esther, and she's saying, my baby is 11 months, but not crawling yet.
11 months and not crawling yet. Okay, that's an interesting one. So the question I will have for Ranti is, at what age did baby begin to hold up the neck by his or herself? And at what age did baby begin to sit without support, just sit without needing a pillow, or, at what age was baby able to do that? Because by 3 to 4 months, baby should be able to hold up their neck by themselves. And around 6 to 8 months, baby should be able to sit down without support. Now, there are some babies that they do not crawl before they start to run around the place. So what will happen is that, yes, they just go from sitting, and then next thing, you find out that they're on top of your shelf, and you're wondering, when did that happen? How did they get on top of that shelf? And you just realize that they just move straight from sitting, and then they begin to walk around and hold things and move around. So, Ranti, please be patient. We always give allowance of a particular time period. So it doesn't mean when we say that a child should attain neck control at 4 months, it doesn't mean that when the child hits 4 months, the child will start to hold up his neck. No, we give an allowance of about 3 to 5 months. And then for walking, we give an allowance of up to 15 months. So 1 year, 3 months. If after 1 year, 3 months, the child is not walking, then you can begin to say, okay, is something wrong here? And even at that, we will still take things into context. For instance, some people who seem to walk late, in quotes, if you find out some of their parents, their fathers might have walked late, their moms might have walked late, and sometimes it's a thing of needing to observe. However, we usually take a history to find out, are there things that could suggest to us that there is something very dangerous that is causing this so-called delay in walking? So for instance, if a child had something like severe jaundice in the newborn period, or when they were giving birth to, they did not cry immediately, and then we now notice a pattern of these developmental milestones are delayed, then we can say that it's likely that maybe it was what the child had in the newborn period that damaged the parts of the brain that were supposed to be giving the body instructions to walk at this age, sit at this age, stand at this age. But if all those are not present, then it's something that we can still observe. So Rosie should not be too worried. She should not be too concerned that baby is not crawling by 11 months. Before you know what's going on, baby will just stand and start to walk around. Okay.
Like a G. All right. Holanike is asking, please, what month can baby start teething?
Okay, that's a very interesting question. Teething is a subject that is surrounded with so much myths, so much controversy. As a matter of fact, sometimes when people talk about teething, you think the children need deliverance because is this really teething you're talking about? There's nothing that teething does not cause. Teething used to cause diarrhea. Teething used to cause high temperature. Teething used to cause babies to vomit. Teething doesn't do all that. But in terms of timing of teething, most children will teeth from anywhere between 4 months and 6 months. That is when the first set of teeth starts to come out, between 4 months and 6 months. Some babies will teeth as early as 3 months, but that is very unusual. And some babies might not remove their first teeth until they are well over 1 year. And that is still perfectly normal. So some parents are very eager for the children to start to eat shawarma and chicken shawarma. So they really want the teeth to come out. And for them, they are not satisfied if they see a 9-month-old child and not a single tooth has erupted. Please don't be alarmed if after 9 months your children still don't have any teeth. We give allowance of 1 year. After 1 year, then we can now start to investigate and try to find out why exactly the teeth have not erupted. So 4 to 6 months is the usual time when most children will erupt their first set of teeth.
All right, thank you very much. I think my last daughter, she was almost 1 year before the first one came out.
Yeah.
Yeah. I wasn't bothered thanks to ATP, so I wasn't bothered. Yeah.
Great.
Samuel Chidera says, my baby is 7 weeks and the scalp of his head is peeling. Please, what should be done?
Okay, at 7 weeks and the scalp of the head is peeling, usually that might indicate some kind of skin infection. Unfortunately, when it comes to skin issues, one really needs to see the child or see the particular situation to make an assessment, because scalp peeling can be a lot of things, from simple, skin irritation from maybe a cream or soap that she's using, to very serious bacterial infections. But of course, I mean, if she was having a serious bacterial infection, I'm sure she won't be on ATP asking questions. I'm sure she'd have flown to the hospital right away, because all those bacterial infections can be very serious. But if I'm to hazard a guess, it's most likely a fungal infection. If she means that the hair of the scalp is falling off, or there are some areas or patches where there is no hair growing, then it might be a fungal infection we call seborrheic dermatitis. And I suggest that she goes and sees a pediatrician or a general practitioner in the hospital, so that they can prescribe, specific shampoo that she can be using, so that the hair grows back. I know there are some children that the place on which they sleep, there's usually one hairstyle that they have, that because of how they put their head on where they are sleeping, and their hair doesn't grow. Their hair doesn't grow very well there. And all the mothers always want that hair to grow back before photo shoots on the first birthday, that, hey, God, Dr. Renner, is this hair going to grow back? That photo shoot must be on point. So Dr. Renner, this hair must grow back. I said, I don't know about that one. You do have hair when you are that age. You do have that hair. So I tease them. So she should see a doctor.
All right, Samuel, if you're still online, for skin issues, it's better for the doctor to see the person before they now prescribe something for you. So do the needful. Marking date Titilope. You said we should not use cough syrup for babies less than 2 years. What if it's prescribed by the doctor?
Okay, very good question. Okay, so there are some cough syrups that are marketed for children that are less than 2 years. Quite frankly, there are some cough syrups that are marketed for children that are less than 2 years, but the physician has to be sure that that is the situation and that is the case. what we try to avoid is a lot of cough syrups are very sedative. And what that means is that they make the babies very drowsy. And one of the only ways by which a baby can tell you that something is wrong is by crying. And so if you were to administer things to make babies drowsy, and then the child truly needs to cry to alert you that something wrong is going on, because they are so sleepy, you will think that everything is fine. Meanwhile, not all is well. Something wrong is happening, and that their only means of communication, which is the crying, you have suppressed it with your cough syrup that is making them to be very drowsy. And so we want to avoid offering cough syrups to that age group because their only means of communication is crying, and you would have ended up suppressing that crying. So for some cough syrups that don't have that, effect of sedation, one can consider administering those ones. But please let it always be under the supervision of a physician. Yeah?
Okay, I got that too. Oluga by Funaya said, my baby is not eating well. Another eating problem. I've tried I've tried reload for kids, still no way. He's 1 year now.
He's 1 year. Okay. What's the name of the person asking the question?
Olugaba.
Okay.
Olugaba.
Okay. All right. Olugaba, very difficult subject to deal with. Children refusing to eat 1 year. First of all, let me just let you know that if you want to give reload kids and the other multivitamins, please give it because you want to supplement. So for instance, the child is not getting maybe all the nutrients he should be getting from his food because he has picky eating ways. You are giving those multivitamins to just make up for the nutrients he might not be getting from his food. But multivitamins do not stimulate appetite. I have said it over and over and over again. Multivitamins don't stimulate appetite. So don't expect that because you have administered a multivitamin that some magic is going to happen. No. Again, you have to be very creative with your meal times, with your food. Again, I am not unaware of how difficult it is in the whole Nigeria setting. I don't want to limit it to only Lagos. Lagos can be tough, but also other states too have their own challenges, in the sense that you might be a working mother, going to work, coming back, taking care of the home. And all this creativity I'm talking about, say, okay, go and try mashed potato today. Tomorrow, try sweet potato. Next tomorrow, try blended broccoli. Next tomorrow, try blended yam or blended cocoyam. All these things I'm saying that you should try out, they can be very time consuming and tasking. But you will find out that at the end of the day, on the long run, it will give you greater peace of mind when you have done this and the child is accepting the variety of things that you have introduced to the child. Sometimes you must play around with flavors, you must play around with textures, you must play around with colors. And that means that there are some children that they prefer things that are a completely smooth texture. They don't want any kind of lumpiness. You have to prepare the food to suit that child's taste. And as time goes by, you will learn and observe that these are the things that the child prefers. There are some that they don't like anything that is too smooth and they prefer something that is a little bit lumpy. Make the food that way for them. There are some people that prefer fishy flavors. Some people prefer blander flavors. Some people prefer things that are a little bit sour. There's nothing wrong with you squeezing a little bit of lemon juice into the food that you have prepared just to give it that sour taste. Sometimes, if it's possible for you to even taste your breast milk, to know what your breast milk tastes like, so that you can try and mimic, because sometimes what you eat as a mother, if you were breastfeeding, sometimes the taste of those things are coming into the breast milk. And so the child might be looking for that particular taste. So think along the lines of what it is that you like and try and prepare those meals and flavors along that direction. And if all fails, please consult a nutritionist who has particular bias for child nutrition, and then get recipes and then get creative with meal times. I wish you all the best with that. It can be very tough.
Yeah, just to add to what the doctor said, Ifunaya, we have a whole course on ATP. We have tips too that can help you. We have guides that can help you. If you just search for complementary feeding, you will find useful resources. Okay, so Anita Idemudia is saying, what could be the cause of my 3-year-old son having serious boil on his chin and having fever? What could be the
Wow.
treatment for it?
Okay, so boil on the chin with fever is clearly a skin infection, but a simple boil generally does not give you a fever because it's a skin infection, it's localized. By the time you start having fever with a what appears to be a boil, you're probably dealing with something a bit more serious, like a condition we call cellulitis, and that just means that it's no longer just on the surface of the skin that started to get under the skin. So in that situation, please, I would suggest that you actually go to the hospital. I don't recommend, just use of any kind of antibiotic, because if you don't use the right dose or you don't give the antibiotics at the right frequency or interval, that infection will not go. If anything, it'll probably get worse and it'll be more difficult to treat. You might spend longer in the hospital. So please go to the hospital, let them have a look at it, because fever in any child, especially if they are less than 6 months, is something that needs to be looked into. So please go to the hospital.
All right. Thanks. Okay, Sylvester Pat is asking another food-related question, which I think you answered with if my baby is 1 year and 3 months. He prefers breast milk than eating normal food, and I'm not they are eating. The weight is 10 kg. How can I make him eat? I think basically the same thing.
Yes. Well, weight is 10 kg. 10 kg at 1 year is actually satisfactory. Even though, we would actually like to see how the weight trajectory has been increasing over time. It's good to know what the weight at that point is, but if he was, say, for instance, 3.5 kg at birth, how has his weight been going? Has the weight increments been satisfactory to get up to this 10 kg? But just from the information, 10 kg at 1 year is actually fine. However, when it comes to, okay, he's accepting only breast milk, there are different, maybe I should address the issue of getting children to stop breastfeeding. First of all, if you yourself as the mother, you are not ready to stop breastfeeding that baby is not going to stop breastfeeding. So do you think that the baby is not accepting food because he is getting satisfaction from the breast milk? Or do you think he's not accepting food simply because he doesn't like the food? Now, if he seems to be getting all the satisfaction in the world from breast milk only, then you need to begin to, and I know the WHO recommends that we breastfeed till 2 years, but if by 1 year you feel like it is because the breast milk is satisfying him, because I can't imagine that at 1 year the breast milk should be satisfying any infant, unless you are just carrying him around everywhere with you in the house on the breast like a handbag. That's the only reason why a 1 year old is satisfied with only breast milk, because breast milk at that point in time is not filling anymore unless you are breastfeeding 24/7. So please, what I'd say is that you need to try to start to wean him off breastfeeding. I know it will be very difficult in the first few weeks. He might cry a lot, he might throw tantrums, but please try to gradually reduce from thrice a day or 4 times a day to twice a day. Doing 3 times at night, try and make it just once or twice at night, and substitute it with formula, so that if you are feeding 3 times at night, make 2 of those feedings formula instead of breast milk, and give him just only breast milk only once at night until you gradually stop the breast milk altogether. In the meantime, don't relent in trying to introduce new foods to him. There are various options, both commercially available and ones that you can actually do and make by yourself at home. So don't relent and hang in there.
All right, I get that. I think we're having so many questions centered around skin issues. This is Joyce. My 4-year-old son has ringworm-like wound on his butt and face. One on the butt has a hole in it. Please, what is that?
Also a bit difficult to decide if I can't see the lesions, but or the skin rash. What I say is that are they itchy? If they are itchy, then you do need to pay attention to that, because some conditions like scabies can actually scabies is caused by a particular small insect, and scabies can be quite itchy and it occurs on the butt and in between the fingers and maybe occasionally on the face. Not usually, but occasionally it might occur on the face. So, yeah, so Louis, I suggest again that you actually go to see a doctor so that someone can have a look at it and then they can prescribe appropriately.
All right. Thank you. This is from Amaka Stevens. My 6 months plus baby has been having pureed watermelon every day alongside other food and fruits for a week. And I noticed her poop now has a deep red tinge to it. Could it be the watermelon or should I be worried?
A deep red tinge to her poo-poo. Quite frankly, I mean, a lot of us take watermelon and it doesn't deeply red tinge our poo-poos. But that's not to say watermelon can't do that. I mean, if she's taking a lot of watermelon, then it can actually change the color of her stool to the deep red tinge. But my own concern is that, of course, and what everybody's concern is that could this be blood? Could this be blood in the stool? Now, it's very unusual that if a stool has blood in it, that it is the whole stool that will be colored red. What normally would happen is that if there is blood in stool, you will see the blood, either staining the body of the stool, or you just see it in the diaper as, a blood stain here and there. And then when you wipe the diaper, you might actually see a blood stain. But that the person is bleeding and the whole stool has been colored red, like red velvet cake with the blood, that's very unusual. Most likely it is the watermelon that is coloring the stool. But what I say is that just to be doubly sure, please take it to the hospital and then let a doctor have a look at it. Just to reassure that if she is otherwise well, so for instance, if she is not vomiting, there's no fever, she's not bleeding from anywhere else, it's most likely the watermelon. And watermelon every day, I mean, I'm trying to vary the diet as well, because you do find out that watermelon every day, at one point she's going to get tired of it, and try and vary the diet, try and stop the watermelon and then see if that changes the color of the stool back to the normal, regular brown. But if you are particularly worried, then please take the hospital for them to have a look at the stool and examine her to make sure that everything is fine.
All right, we got Rosemary is saying, my baby is overweight and an EBF baby. We'll soon start complementary feeding. Should I control his meal? Because I'm told not to give him pap.
Okay, very interesting. I wonder how, anyway, I'm sure she must have seen a doctor that would have given her that diagnosis of the baby being overweight. Now, babies that are exclusively breastfed and they seem to weigh more than their expected weight for height, which is what we actually use to determine obesity, more or less obesity. That's what we're trying to call it in infants. Because this is what the truth is. It is very unlikely that exclusively breastfed babies will be overweight in an unhealthy way. Our bodies are composed of a lot of things. Our bodies are composed of muscles, bone, and fat. Now, babies who are overweight, especially those who might have been fed on formula that is very high in certain amounts of protein, have a lot of fat. Meanwhile, you find out that exclusively breastfed babies, even when they appear to be overweight, they have a good amount of muscle, they have a good amount of bone weight. So it's not just fat weight that we're dealing with. So these are children that, despite the fact that they appear heavy, they have good muscle and bone. What we don't want is excessive fat. And there are ways of determining this, using, skin fold thickness and certain other parameters that we do. So don't be too alarmed if you have truly done exclusive breastfeeding and your baby appears in quotes overweight. Most likely it is good bone and muscle mass. However, what I say is that please don't let people tell you that, oh, you shouldn't give pap. You can give pap. You can actually make all the meals as as recommended. So, for instance, whether it is pap, whether it is what's it called, mashed potatoes or pureed rice, blended fruits. Please let the child have it as for his satisfaction. You know that initially when you're introducing semi-solid foods, you should do only twice a day at 6 months. You can now increase it thrice a day at about 8 months, and then 4 times a day at about 1 year. And initially, all you need for each time you are giving the complementary feed is just 2 tablespoons. 2 tablespoons. It doesn't have to be very much, morning and night. And let him continue on exclusive breastfeeding for the remainder, of course, for the remainder of the meals, during the day. So at 6 months, twice a day of the complementary feeds, 1 or 2 tablespoons, and then continue breastfeeding. So please give pap, give whatever it is that you want to give. Your child is a healthy child.
All right. Okolo Joy is saying, my baby is on to 3 years by June. She's been having recurring cough, catarrh, and high temperature. We have treated typhoid and malaria twice. I want to know how to prevent any future occurrence.
3 years old, recurring cough and catarrh, high temperature. Okay, so typhoid and malaria don't cause cough and catarrh. So I hope it's so treating typhoid and malaria for catarrh, cough, and fever probably isn't the best way to go. Now, recurrent cough and catarrh, the question I always ask a lot of parents is that during the lockdown, was your child having cough and catarrh and fever? A lot of people tell me that no, during the lockdown, their children were not having any kind of illness. But you see, once school resumes, you are likely to begin to see all these illnesses coming up again because they are interacting with children, other children once again, and so they're bringing illnesses back. The other thing, of course, that I'd like to find out is if they have mold in their home. So all these wet walls that start to grow all these blackish, whitish things. Those things can make children very ill, even adults very ill. So please, I would like to say that if they have mold in their home, they should try and repaint with mold-resistant paints, or they should move away from the house. That if there's mold. If not, what I'd say is that please make sure that you are giving your child nutritious foods. So things like fruits, vegetables, pureed fruits, fruit smoothies, watermelon, oranges, pawpaw, because these things actually prevent children from developing these respiratory tract illnesses because they have zinc, they have vitamin C, vitamin E, and a lot of nutrients that actually prevent infections in these children.
All right. Thank you again. This is Samuel Chidera giving us an update. She says the hair is not falling off. The skin is just peeling off. I do apply cod liver oil on his hair. Could it be the cause?
I'm not aware that cod liver oil is something. Thanks, Chidema. Thanks, Chidera. I'm not aware that cod liver oil is something that one should apply on the hair. It's very good. I mean, it's a very good product, for skin. But when you take it, through the mouth, but why not just resort to something like, I don't know, coconut oil, or what's normally even used for baby's hair? I know people do a lot of coconut oil and the other commercial baby oils, but what I'd say is that cod liver oil is really not recommended for direct application to the skin. I'm not aware that it does anything in that regard. So please try and change to coconut oil and see how that does. Sorry, I just to quickly address the issue about the lady that complained that her baby was overweight. There are some situations where baby has an endocrinological problem, and that just means that there are certain hormones that are making the child to grow excessively. It's a particular hormone that they call growth hormone, and with growth hormone, if there's an excessive secretion of that growth hormone, the child might actually be excessively heavy, might gain weight excessively, but it isn't very common, So what we will now say is that if that pattern of overweight continues beyond the first year, then she might need to be evaluated by an endocrinologist or even now she can actually, solicit the or enlist the help of an endocrinologist to evaluate the child and make sure that the child is not having any endocrinological issue, before the child even gets to 1 year. So I think I thought I'd just chip that in.
All right, got it. Fumbi is saying, my baby is 2 years and 3 months. Her head is still breathing.
I'm assuming that she means that the anterior fontanelle is still open. That's a very interesting way of putting it. Her head is still breathing. So, Fumbi, usually the anterior fontanelle really should close somewhere around 18 months. That's 1 year, 6 months. Even though we can give some allowance of up to 2 years, but if it doesn't close at 2 years, 3 months, please take to the hospital, because there are some conditions in which it will fail to close on time, and those can be things related to a lack of vitamin D or rickets. So please take to the hospital and let them have that checked out and evaluated, because at 2 years, 3 months, that's a delay in closure of that soft spot that we call the anterior fontanelle. She needs a hospital visit.
Okay. Damisa is saying, good evening, doctor. Please, my daughter is a year and a half, but not eating yet. She prefers akamu and tea. If I try other foods, she will run away or bring with her.
Oh dear, Bilikisu, sorry about that. Children who run away from meals and meal times, that's a very difficult one, because unfortunately there is no way to happily force a child to eat. You are the one that is giving her the tea and the what's the other thing called? Tea and pap. Tea and pap. So you are the one that can also give her something else. So please, please, and please again, I would really want to urge you, make meal times family times. What happens is that children observe, and children will never do what you are not doing. So if you find out that you are one of these people that eats on the go, you sit and your meal time is not at the same time as the child's meal time. Your meal time is separate, such that you make the child's meal, prepare the meal, give the child, and then feed the child, and then you go up and do what you want to do, and you eat when you want to eat. The child is not going to be encouraged to eat. Meaning that when you want to eat, or when you have prepared the child's meal, it's important for you to actually also be having your meal at that time. Adjust your schedule to have your meal when the child is eating. Somebody asked me that, how come children just leave all their toys and leave all the things that you give to them and go and start playing with dustbin and shoe? That's because they are playing with what they see you playing with. They think you're playing with the dustbin. They think you're playing with the shoe. So that's what they go for. So if you are not having your meal times when she is eating as well, she doesn't realize that food is food. And so she thinks that, okay, the only thing from that, so she chooses what she decides is food. And so for her, she thinks that, oh, it's tea and pap, that's my food. So she doesn't realize that, oh, this thing that mommy is eating is actually food. I would like to try it. And so you need to try to adjust your meal times to make sure that once you prepared her meal, your meal is also there with her, so that she's able to try out of your food. She might ignore her food, but at least she'll have the interest in trying out your food. And that's how to gradually introduce her to the different kinds of foods that are available. So Bilikis, I think you should try that out.
Okay, thanks. Blessing Mutali. Good evening, doctor. My baby of 2 months is pooing like 5 times since yesterday.
5 times. Okay. So Blessing, what I'd like to ask is that, is your child being exclusively breastfed? Sometimes exclusively breastfed babies can poo as much as 6 times a day, and it is still perfectly normal. But that stool of consistency has to be like, the egusi. It shouldn't be watery, such that it's seeping out of the pampers, or when you open the pampers, all you see is just 1 or 2 blowing of poo, and the rest is water that has seeped into the pampers. No, if it is like that, a goosey-like consistency, then we are okay with that. However, if your baby is on feeding bottle is being bottle fed. My concern is that the bottle is probably not being well sterilized, and your baby might be having what we call gastroenteritis, which is diarrhea, which is watery poo of 2 or more times in a day. So that is a concern for me. So if your baby is being bottle fed, with a feeding bottle, please take to the hospital so that they can prescribe things like ORS, zinc, and floranol to make sure that it isn't a tummy infection.
All right. This is from Adebimbe. She says, my baby is 5 weeks and 2 days. He groans whenever he wants to poop and while sleeping as well.
Okay, so I think my first question, of course, is baby being exclusively breastfed, and is the poo hard? If baby is being exclusively breastfed and the poo is soft and nice, like that's a goosey, then there is no reason for you to worry, because babies always grunt when they want to poo. That is just their hallmark, and they do. I just wonder, what's really going on? Are you trying to give birth to another baby? But what's happening is that their muscles, the muscles of their tummy and the muscles of their pelvis, are not strong enough to actually push out that poo. And so the way that they respond to that is by all that grunting. But it doesn't mean that anything is going wrong. However, if the baby's poo is hard, and baby is on formula, then you might need to change the formula to something that is less that does not make the poo to be hard. That is probably what I would say. And if you're exclusively breastfeeding and the poo is hard, then there might be something that you are eating that is entering into your breast milk that is making the poo hard. And one of the most important culprits in such a situation is actually milk. So in such a situation, you might actually have to stop milk. You have to stop taking milk so that your baby's poo can actually become softer. But if at 5 weeks, baby is grunting to poo and the poo is nice and soft, please don't bother. Eventually it will clear.
Yeah. When I see this kind of questions, I put myself in the baby's shoes. To lie down and poop, I have to run.
To lie down and poop, it's not easy. Very uncomfortable.
To be fair on your members, to be fair on your constituent members.
Thank you. To be fair on them.
All right. Chi Diebere Ugoyin Naya. Good evening, doctor. Please, what will make a baby of 17 weeks to always straighten and stiff his legs?
So 17 weeks is about 4 months. So it's always straighten and stiffen his legs. Well, if that is happening and you find it very difficult. So for instance, a lot of babies always straighten their legs, but it's temporary. So they'll straighten and stretch and they'll get excited and then they'll bend their legs again. But if baby is stretching the legs and stiffening the legs and you're finding it hard to, for instance, if you carry the baby up and the legs are still straight and stiff, then that's a problem that might indicate some sort of brain issue. So you might need to take to the hospital for them to have a look at. But if the baby stretches so just momentary, maybe like for a few seconds and then goes back to playing and doesn't have any other issue, then it isn't anything to worry about. But if that stretching is constant, such that the legs are stretched, you try to bend it and baby you find it difficult to bend, then please take to the hospital.
All right. This is Amaka B giving an update. Exactly, like red velvet cake. This is the lady who feels watermelon. Yeah. So there is no red stain on the diaper or after wiping. So that's a sorted, I think.
Yes, that's sorted.
Yeah. Bukolami is saying, what could cause a sudden fall in the neck or tilting the neck to a particular side in infants?
Okay, so Bukolami, very interesting question. There's something that we call torticollis. Torticollis is a situation in which the neck is just bent to one side, and sometimes it might just be that a particular muscle in the neck is either shortened, is not long enough to keep the neck, straight in one direction. Sometimes there's actually even a swelling of the muscle that you might be able to see there. What can happen is that the patient might need to get physiotherapy to help the neck to straighten out. But what she said is sudden. If there is a sudden fall in the neck, that term sudden makes me think, a bit, more about something like what we call a seizure or a convulsion, whereby even though with convulsions, it's not just with that type of convulsion we call an infantile spasm. It's not just the neck that will fall; it's the whole body that falls forward. But that suddenness of falling of the neck is a bit worrisome to me. So I'd like to say that she should take to the hospital. If possible, I think what will be useful for us is for her to do a video. Let her make a video of when that thing is happening, so that when she goes to the hospital, she can actually show the doctor what exactly it looks like. Because what I found is that a lot of children, they will display at home. By the time they get to the hospital, it will be like as if nothing ever happened, and they won't have it. So please, if it's possible for her to actually make a video of that particular event to show the doctor when she gets to the hospital, it will make a huge difference in helping us to make the diagnosis.
All right, Bukolami, you heard that. Amaka Stevens is saying, my 6-month baby now cries when she wants to poop. She's mainly on breast milk, but also takes pureed fruits and foods and vegetables. She also takes water. Her bowel movement has changed from daily to every 3 days. I've been through the complementary feeding guides. What could we be doing wrong, please?
Okay, so she's a million breast milk, pureed fruits, also takes water, one more from daily to every 3 days. So again, I always say that when it comes to bowel movement, you've not finished describing your bowel movement of a child until you've told me whether the stool is watery, hard, or soft. So I need that information, very key. Telling me whether the stool is hard is very key, because even if a person poops once in 40 days and 40 nights and the poo-poo is soft, we don't consider it as being constipation. The poo-poo necessarily has to be hard for us to say that this child is constipated. Now, what I'd say is that, are you giving any other kind of milk, any formula feed? And then is there any blood in the poo-poo? Also quite important, an important question to ask. And because the truth is, some kinds of feeding.
Hi, Dr. Renner. Hi, Dr. Renner. Apologies, people. Just hang on for a while. I think he has. Okay, you're back. Yeah.
Yes. So I was saying that I would really, really like to know what the consistency of the stool is like. That would give me a better insight on what could be causing this. I was saying that some food intolerances can actually change the consistency of the stool from being soft to actually being quite hard. So that's something that we need to establish. So what I'd say is that if you are giving formula, consider changing the formula to something that is either because sometimes there's something that we call cow's milk protein allergy, and that can give constipation, hard stools, infrequent bowel movements, and so you might need to change something that doesn't have as much cow protein in it. There are some formulas that have reduced amount of that cow's milk protein in it, and you might need to consult your nutritionist or pediatrician for you to sort that out. But for her particular issue, crying during pooping is not a pleasant experience for anyone. There is a magic formula. Please get beans, boil beans in a pressure cooker until it is very, 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 very soft, and then blend it, and then flavor it with a little bit of butter. You really don't need salt, for the children at that age. If you want a little bit of flavor, you can put a little bit of crayfish inside, or a little bit of Titus that has been deboned. Blend it very well, and then give the child to eat. But this is if the poo-poo is hard. If the poo-poo is hard. If the poo-poo is not hard, please consult your pediatrician and they'll try and get you sorted.
All right, moving ahead. Rosemary saying, good evening, doctor. My 17-month-old baby drinks water a lot, and his lips gets dried easily and cracking. What could be the cause?
So dry and cracked lips and the amount of water you drink are not really correlated. Some people just have a tendency to have dry and cracked lips. So it's good that baby is drinking as much water as possible. But for the dry and cracked lips, please, I'm not sure what could be causing it, but please get what's it called? Vaseline and rub on the lips. However, what I'd like to say is that sometimes is there dryness or cracking anywhere else? So, for instance, on the palms, because there are certain types of nutrient deficiencies, especially zinc, that can give you skin issues. So, if it's possible for you to get, this is where I would say get a multivitamin that contains zinc, that contains vitamin A, because those really help with skin integrity. In the meantime, for the cracked lips, please rub something like, Vaseline, Blue Seal on it to make sure that the lips are not cracked.
All right. Noye is asking, my 5 years old baby always complains that the vagina is peppering her and that no one touched her. What can be the problem?
So vaginal, now when you say peppering, because with children it's a bit difficult to characterize these things, especially if the vagina was itching her and then she scratched it, it will begin to hurt her, So was the vagina itching first, and then she scratched it and then it became painful or peppery? Those are the things I'd like to, determine. Is there vaginal discharge? That's it. Because a lot of the times, the truth of the matter is that there's something we call a non-specific vaginitis, and that can be from a lot of things. It might be that she might be reacting to the material of her underwear that you're giving her to wear. She might be reacting to, some, soap or thing that you are using to bathe her, or the technique that you're using to clean her up after she has finished going to toilet, especially if you are cleaning from back to front, so that she has poo-pooed and then you are wiping from the back towards the front. You might be bringing in some poo-poo from the back towards the front, and it might be causing an infection in that area. Also, good underwear hygiene is very important. Some babies or some children sweat more than others, especially in that area. So make sure that you're changing. Don't use a one-stop shop approach for everyone. So if she sweats a lot or she plays very vigorously, once a day changing of the underwear might not be sufficient. You might need to change your underwear twice or even thrice a day. And sometimes, when she's in the house and you're sure that, she's not anywhere else, she doesn't need underwear all the time. Sometimes you might not even decide not to even use underwear so that you are sure. So please, once you're changing the underwear, also inspect the underwear. Make sure that there is no vaginal discharge so that you are sure that you're not dealing with something that might require treatment. However, in the interim, please take it to the hospital, let somebody have it examined and looked at to make sure that there is no rash and to make sure that it can be sorted out.
All right. Taram is saying, my baby is 5 months old and weighs 10 kg. Is that okay or overweight? Birth weight was 3.4 kg. He is on EBF.
Wow, that is a big baby. It's 1 year olds that in my mind usually have on the average 10 kg. But every baby is quite different in their own right. So what happens is that babies should double their birth weight at 5 months. Meaning that if I was just to calculate based on, and this is not a hard and fast rule, this is just a rough estimate. So if baby was 3.4 kg at birth, it means that at 5 months, baby should be about 6.8 kg. And baby is 10 kg. Wow, that's a big baby. As a matter of fact, this kind of baby, the kind of baby that all the mothers in the place where I'm practicing come. That's how chubby they want their babies to be. But it's hard to see. Yes, I will need some more information. So things like date of birth. I'll need to plot baby's weight on a specific chart to see if baby is overweight or not. But since baby is being exclusively breastfed, I wouldn't want you to panic too much. The general rule is that baby is most likely all right. But I'd say that if this trajectory of excessive or child being heavy continues beyond 6 months, then please consider seeing an endocrinologist to have him evaluated to make sure that everything is okay.
Okay, moving on. It's almost time up. Obi is asking, my daughter of 6 years and 2 months has this cluster of blisters on her upper lip. She finds it irritating and said she won't go to school tomorrow. Is there anything I can do to help her?
So a cluster of blisters on her upper lip. Is there fever? That's my first question. 6-year-old, is there fever? And if there isn't, is it itchy or painful? If it's itchy or painful, or if it's painful, then you can apply Bonjela gel. That can help. But for me, the more important thing is to note, why is she having those blisters? Has she had them before? Again, with skin issues, it's always best the doctor actually sees what the skin lesion looks like and then prescribes based on the diagnosis that he makes on inspecting the skin issue. But most of these things are actually self-limiting. They'll probably just come and go away by themselves. Of course, it brings me to the question of, if she doesn't want to go to school because she's having a blister on her lips, if that blister is potentially contagious and can infect or affect other children, then she really should not go to school. So please actually take her to the hospital, let it be looked at by a doctor, because the way children are, even in this era of corona, sometimes they can share spoon with one another. Just like what you say to them, they might actually share cups or share something with one another. And if it's infectious, she might transmit it from herself to other children. And so you really don't want that. And so please don't take her to school, take her to the hospital, let it be evaluated. And then if it's found to not be something that can be transmitted, then she can go to school.
Okay. Blessing says, good evening, doctor. My baby is 15 months and someone told me that she has tongue tie. Should I be worried?
15 months old tongue tie. So the truth is, with a tongue tie, a significant tongue tie usually is disturbing enough to prevent them from actually sucking very well in the newborn period. So what happens usually is that if the tongue tie is really there, you would have known right from the very early newborn period or early infancy that this was an issue. But if so far the child was sucking well, it didn't impair the child from sucking or eating, then it's unlikely to be a significant tongue tie. Some people have, and what a tongue tie is, a short frenulum, this thing under the tongue. But what happens usually is that if there is no issue, if there is no issue with feeding, there's no issue with speech, then it's unlikely to be a significant tongue tie. They shouldn't stress her. There's no tongue tie there.
Okay. It's almost time, doctor. I know you want to run off somewhere. There are still lots of questions, but I'm trying to pass the ones that has to do with cough and catarrh, because you've already talked about that several times, and also the ones on feeding. But there's this one here. My 6-month-old baby always brings out spit and constantly opens his mouth even when not having a cold. How do I make him to be closing his mouth and stop spitting out?
If this is something that has started, say, within the last 1 week, then your baby might be teething. And you find out that their mouth is always open, they're always drooling saliva, they want to bite and chew on things, your head, your weave-on, your shoe. They want to just chew on everything. And so it might be that your child is actually teething, and that might be what is going on here. If your child is snoring and having these issues, which is very unlikely, then they might need to see an ear, nose, and throat specialist, who might need to examine them to make sure that there's not any tissue that is blocking the back of their throat. Other than that, most likely this is teething.
Okay. Bright is saying, good evening, doctor. My baby is 3 years, 6 months. After stooling, I will notice blood stain in the wipes I used on him. Please, what again should I be worried?
The commonest cause of blood-stained poo-poo in babies, especially 3-year-olds, especially if the poo-poo is hard, is something that we call an anal fissure. Now, an anal fissure is the sort of like tear in the anus region that causes blood to come out whenever the baby poo-poos. Of course, they are going to have to look at the bum to make sure that there isn't anything else protruding out. But usually, the most common cause of blood in the stool or blood stains too for babies that age is what we call an anal fissure. And she has to go to the hospital, have it looked at. If the baby is having hard poo, that needs to be treated. If not, that bloody stool is unlikely to go away by itself. And then, so essentially she does need to go to the hospital to have a look at it. Yeah.
All right. Uchenna here is agreeing with what you already said. She said, you are right on this. We are on that table. My eats when everyone is eating, you see? Yeah. Give him separately and he will take.
Exactly.
So, yeah. Let's take this last one, doctor. Sorry. Good evening, doctor.
No
Is there
problem.
a quantity of water a baby starting complementary feeding should take?
So a minimum amount of water, baby starting complement. That's a very good question. Minimum amount. So I'd say there isn't a minimum amount, but what I'd say is that if you start complementary feeding and yet baby is still on breast milk, baby doesn't really need that much water because the breast milk is still supplying a lot of water. But I'd say that for each complementary meal that you give baby, you can give anywhere between 50 and 100 mils of water. Okay, that's yes, so between 50 and 100 mils of water. Just to, and let me putting that in context, that's about 1/5 of a bag of pure water. And so that's that's about 1/5 of a bag of pure water, with each meal, and that's just twice a day. So 50 to 100 meals with each feed, I think is what is recommended.
All right. Thank you so much, doctor. Please, if we didn't answer your question, I just went through, and I know it has to do with cough, with catarrh, and complementary feeding. The doctor spoke several times about this, and you also find it on ATP. Doctor, and he has a schedule and he needs to run. Doctor, any last words from you to the people?
So it's just to tell everyone that motherhood is the most important job in the world. And so just kudos to everyone out there, all the mothers out there who are taking care of these leaders of the future for all of us. Again, just to emphasize that if in doubt, please speak with a physician. Don't do self-medication because that really can, cause more harm than good. And trust your instincts. You as a mother, you know best. You know what's going on. You know your child. If you feel something is wrong, then most likely something is wrong. Trust your instincts and see a doctor.
All right. Thank you so much, Dr. Renner. We're really glad that you came for our ATP Live to answer all of those bumper-to-bumper questions. And
Thank you,
to
Angela.
everyone who's watching us, from the beginning, we had about 100 plus people. Thank you for joining us. See you again next week, Monday, and enjoy the rest of your evening.
Thank you, Angela. Bye, everyone.
All right. Bye, doctor.